So we're all in this fight against COVID together, whether or not we're in the school or whether or not we're out at home or in our communities. And so we need to reinforce the need to wear masks, to socially distant or physically distance ourselves from others, to practice hand hygiene. And I would encourage the Sidwell community to not only help enforce those mitigation efforts while at school, but also while they're back at home. As a pediatrician, I feel like it's really important to state that we need to make sure that all of our kids get their routine immunizations. Before COVID, we had a lot of infectious diseases out there and circulating, and we have effective ways of protecting our children with vaccines. And so it's particularly important that we make sure that our children get vaccinated against things like measles and chickenpox, because we don't want that added layer of illness on top of COVID-19. And I would also strongly encourage everyone to consider getting a flu vaccine this fall, because we know that with COVID-19 and flu that this situation could be very complicated, having two respiratory illnesses circulating in our environment. In addition to all of the other layers of protection that we can put into place, such as mask wearing, physical distancing, hand hygiene, we totally understand as public health professionals and of course as parents that social distancing fatigue is setting in. And so as you think about expanding potentially your social circles, and your kids want to reach out and have opportunities to be with their friends, it's really important to make safe choices and to try to reinforce the need to use these preventive and really safety measures, both in the school and at home with your children.
Well, the school has embraced a risk mitigation strategy that does exceed significantly most public guidance on how to safely open a school. Some of that guidance is from the Centers for Disease Control, some from the American Academy of Pediatrics, and some from other sources, academics, institutions in particular. Our protocols include changing the cohort structure so we know who students are exposed to when they're in school. They include the plexiglass dividers and the physical distancing. Importantly, they do include the wearing of masks at all times, in all settings, and they include specific activities like managing the flow of individuals through the building in a single direction manner and in a very safe and protected way to enable social distancing to take place. In addition, there's so many other things the school is doing: the installation of new filter technologies, the use of UV lighting, disinfectant systems, the decision to create a day a week specifically to deep clean and disinfect the school environment. All of these actions go beyond most standard protocols and recommendations and are designed to make sure that teachers and students both are safe and really feel confident in their safety while they're pursuing the important educational mission that we all embrace.
So we're all part of the Sidwell community. And we all have an obligation to each other during this pandemic. I think that we all would agree to. So great efforts by the school, by Brian, Jasmine, Min, and the entire team here at Sidwell to make it the safest environment possible for staff, teachers, and students once they come back onto campus. But what can we do? What is our individual and family obligations to also keep our Sidwell community safe? First, we can screen ourselves every day. Do we feel good? Are we running a temperature? Do I have muscle aches and joint pains? Do I have a cough? All of those become important in self-screening to make sure that we don't bring ourselves into this environment and put either teachers or students or faculty at risk for developing what could be a COVID positive case. So screening in advance becomes important. The second piece is equally as important, is around how do we continue to do risk mitigation outside of school. In the last 4 weeks, more evidence has surfaced from the contact tracers within the state of Maryland, and one of the most common places for transmission for COVID positive cases has been, remarkably enough, in family gatherings. Why is this important? Well, families, now we're 5 or 6 months into this pandemic. Everybody now wants to see each other. They want to get back together. Families want to re-engage. It's important. But we have to adhere to masking, physical distancing, and hand washing regularly. We all want to hug each other. It gets back to the issues around students. We're a loving community. But when it comes to family and to friends, and especially for our teenagers, they can't be in large groups unmasked. They can't be with their friends in proximity and be unmasked. We have to be disciplined, and we owe it to the community. We owe it to the Sidwell community. We owe it to each other. We owe it to the commitment of Sidwell to educate our students in the best possible ways to drive the numbers down. And the way we do that is adhering to those principles. And together as a community, we'll have a tremendous opportunity to participate and be part of the solution to drive the numbers down for COVID-19, which will then expedite and speed up our ability within the medical advisory team, making recommendations to Brian and his team to get our students, our kids, our sons and daughters back onto this incredible campus sooner, to elevate their education and once again be part of the Sidwell community.